Hello guys, today let us talk about an important topic in neurology, which is Guillain-Barre syndrome. So it is also called as acute inflammatory demyelinating polyneuropathy or acute inflammatory demyelinating polyradiculoneuropathy. So its onset is within days and there is inflammation around the nerves leading to destruction of myelin. So the basic pathology at the root of Guillain-Barre syndrome is molecular mimicry. Because of an antecedent infection, the immune system produces antibodies, which is natural. Now, in GBS, these antibodies, which were originally meant for the infective agent, cross react with GM1 ganglioside abundant in neural tissue. This causes damage to myelin and hence block in nerve conduction. So until now we've seen there is GM1 on nerves, there are anti-GM1 antibodies, then there is complement mediated destruction at paranodal axon and glial junction, disruption of cluster of sodium channels, conduction block, flaccid paralysis. At the onset there is no fever as such, but 1 or 2 days before the onset the patient may complain of back pain, which is a radicular pain, or sensory symptoms like tingling and numbness. But after that 1 or 2 days later, the patient complains of weakness. The weakness is of ascending type. It is classically symmetrical and can lead to quadriplegia. Now, the muscles of respiration can also be involved. Hence, it is always advisable to keep a measuring tape by the side of the patient and check for chest expansion. Also, watch out for cyanosis. If present, patient may need mechanical ventilation. Now, the deep tendon reflexes are attenuated early on, but later they may be completely absent. Autonomic involvement is common, like wide BP fluctuations, postural hypotension. So along with that, arrhythmias can also be seen. Therefore, ECG is very essential with regular blood pressure monitoring. Now, diagnosis of GBS Asbury criteria is very helpful. Nerve conduction studies will show decreased velocity of conduction and or conduction blocks. And another investigation, can you guess from this image? Yes, this is a lumbar puncture, a CSF tap. Now, in CSF tap, the characteristic finding is albuminocytological dissociation. The damaged radicle will leak out proteins in the CSF, which will lead to raised CSF proteins with normal cell count and sugars. Now, coming to the treatment, as in any medical condition, we always pay attention to the A, B, and C: airway, breathing, and circulation. But coming specifically to Guillain-Barre syndrome, what we have in our arsenal is intravenous immunoglobulins and plasma exchange. An important point is that corticosteroids are not helpful in Guillain-Barre syndrome. So thank you so much.